All right. Good afternoon, everyone, and welcome to this powerful, interesting convening. This is the Nigerian AI Collective's first ever health sectoral webinar. We're gathered today not just to talk about artificial intelligence or health in isolation, but to explore how these two forces, when combined with the right human capital, can revolutionize the way we protect lives, deliver care, and build systems that leave no one behind. For those just joining us, thank you for joining. And as you are coming in, please just put your name in the chat box and where you're joining from. You can also mention your organization. This is not just a meeting to learn alone, but also to network with people on this call with us. AI can spot trends humans may miss, but only people like you and I in this room can ask the right questions, design with empathy, and implement with equity. This webinar is happening on the heels of World Blood Donor Day, and there's no better reminder of how the human need meets technological potential. So let's open our minds, challenge assumptions, and co-create the future of smarter, scalable, community-driven health systems in Nigeria. And so to everyone watching me right now, you are not just an audience, you are part of the collective power shaping this future. And on this note, again, I welcome you to this webinar, Uniting AI and Human Capital for Scalable Community Health Impact. All right, so to take us forward, I'm going to yield the floor for the opening remark. And to give the opening remark, we will have the co-founder and CEO of MDoc Healthcare. If you don't know, or if this is the first time you're hearing of MDoc Healthcare, you can check them out on LinkedIn. Just type it in Google, MDoc Healthcare, and read about, what they do. So I'm bringing up the co-founder, CEO, MDoc Healthcare, and president of Dr. Nneka Mobison, to give us her opening remark. So let me confirm if Dr. Nneka is currently available. But while we're doing that, I'm seeing the messages just, increase. I'm seeing it just increase. All right, so please just keep putting your name. Okay, so do we have
Could we unmute Dr. Naka, unmute and enable the video so she can turn on her video?
Dr. Nneka, if you're speaking, we cannot hear you. Okay, it looks like the help desk is giving her support.
Yes, thank you so much. Can you all hear me? Okay, fantastic. Thank you so much. Good morning, good afternoon, good evening, everyone. On behalf of MDoc, eHealth Africa, and the Nigerian AI Collective, I'm really excited to warmly welcome you to this inaugural webinar with the theme Smarter Health, Stronger Systems, Uniting AI and Human Capital for Scalable Community Health Impact. We're truly honored to co-lead this conversation alongside forward-thinking partners and under the visionary leadership of the Nigeria AI Collective, an initiative of the Nigerian Federal Ministry of Communications, Innovation, and Digital Economy. As we gather today virtually, it's so clear that the future of healthcare in Nigeria and across the globe, especially Africa, is tightly linked with innovation. And more than just innovation, it's about the responsible, equitable, and human-centered use of AI to tackle the health challenges we face in areas such as NCDs, maternal care, and more, in particular on this important day in terms of blood donors, also blood transfusions, and so much more as related to blood transfusions and blood donor care. I speak for MDoc and our partners gathered here to say that our experience building and working with AI tools that advance the health experiences of the people we serve has shown us how powerful digital and AI tools can be when they're rooted in empathy, data, and when they're co-designed with the end users that we're all working to serve. But the reality is that tools alone are not enough. We need a strong, multi-layered ecosystem, a digitally and AI literate and supported health workforce, quality and cross-sector collaboration, also rooted in trust, that ensures that AI technologies actually reach the communities that they are meant to serve and propels them forward for the promise of a greater Nigeria, a greater Africa for generations to come. Today's convening is a step in that direction. We're so excited to hear from brilliant minds, see impactful demos, and together contribute to the already impressive ongoing groundwork in Nigeria for scaling AI solutions that are not only smart, but inclusive, sustainable, scalable, and measurably impactful, and ultimately will really transform, again, not just our country, not just our continent, but the world. Thank you all for being here and for the work that you continue to do to scale health for AI for health through technology. I wish every one of us a phenomenal session. Thank you again.
All right. Thank you very much. Thank you so much. Can you use if you're able to use your emojis to just put up the clapping emoji. Thank you, Dr. Neka, for that very sound opening remark. Thank you so much. All right. So we'll be having a keynote address. And the topic of the keynote is the future of AI-enabled healthcare in Nigeria. And to deliver this keynote address is none other than the founder of Data Science Nigeria in person of Dr. Olubayo Adekombi. Please, let's put our hands together and welcome Dr. Olubayo.
All right. Hi, everyone. So Dr. Baya is unable to join at the moment, but I'll be taking it on his behalf.
Oh.
Okay. Can you all hear me?
Yes, we can hear you, Sean.
Okay, great. All right. So I'll be speaking to his slides, and I'll really be just talking to the collective itself and then be setting the context for the National AI Collective. And then I'll be speaking to the future of AI-enabled healthcare in Nigeria. All right, so there's a popular African proverb that states that if you want to go fast, go alone. If you want to go far, go together. And this is the why of the National AI Collective. And the goal is, how can we collaborate? How can we move together to ensure that innovations are propelled in the country, and not just in the country alone? It's something that was set the standard for Africa as a continent. So for the collective, the goal is to bring people together to collaborate to ensure that we forge an evolving ecosystem, a strong network of people across different strata, research and training. We have people from communities, platform enablers, public advocacy, people in the application ecosystem, startups, dedicated co-working hubs. And so the goal of the Nigeria Collective is to, bring these people together and see how we can drive innovation. And what we currently have, which is for the health sector, is one of those initiatives. How can we ensure that the health sector, there is constant innovation in the health sector? So generally, the pillars of the National AI Collective is on 5 pillars. The first is knowledge sharing and collaboration. Let me confirm that my slide is up. Yes, I can see. Okay, so the first pillar of the Nigerian AI Collective is knowledge sharing and collaboration. How can we bring together to collaborate, to share knowledge? Then the second is capacity building. The third is innovation and research. We are also very big on public policy and advocacy, and then international collaboration. And during this short address, I will be walking you through each of these 5 pillars and how the National AI Collective is positioned to ensure that we evolve on this. So the first, our focus is knowledge sharing and collaboration. And with this, we have an AI Collective Leaders Learning Series. It's a 13 video series on how AI can help CEOs, executive leaders. And we're happy to share this with anyone that is looking at, having this series like an LMS, a learning management system. We've shared it with some organization, and we are, bringing this series to people, executive C-level organizations need to know how to drive AI in their industry. And that is what we do in the knowledge sharing and collaboration focus. Okay, so moving forward, capacity building. We ensure that we build a lot of capacity. And what we are currently using to drive that is the National AI Repository. So the National AI Repository contains technical learnings across different sectors, where you can just go to the repository and then check by sector. You can learn various, we have a lot of learnings, both local and international learning that you can connect to. And so the repository finds like a one-stop shop that gives you everything that has to do with AI in your various sector. Then innovation and research. So we are really engaging a lot of industry and sectors to drive innovation and research. And one of those steps is what we currently are doing right now, which is the health sector. We want to drive innovation in the health sector. And we are saying, okay, the first thing, we need to understand what is happening in the health sector before we begin to bring developers to come together to have acts, to ideate on how we can build sustainable solution for the health sector. So we are very big on innovation and research. Then the next agenda is the policy and advocacy. And here we are promoting, best practice. How can AI be done ethically? What are the responsible AI development steps that the industry needs to be aware of to ensure that we're not just building, but we're building responsibly. And we're ensuring that every step we are taking for the collective is in line with global and benchmark ethical standards. So that is what we do in policy advocacy. Then lastly, we also look at international collaboration, and that is where we are looking at how can AI top developers abroad, how can they collaborate with those in-house? How can we ensure that there is a synergy between international experts and local experts? And that is where we are partnering with the Deep Tech Ready. This is an initiative that the AI Collective is sponsoring under the Diaspora Connect. So we have AI experts all across the globe. Currently we have over 100 of them, and they are supporting local talent, people that are learning under the deep tech. They are providing they are providing mentorship to ensure that the local talent are also, enabled. And so speaking briefly on the future of AI-enabled healthcare in Nigeria, 4 key things is what I would like to emphasize. And number 1 is AI must begin with people. Yes, we want to drive innovation in the health sector. We want to drive, AI research, and a lot of products are being built. It has to begin with the people. So we're not just creating innovation that does not impact the people. You want to build solutions that impact the people, which are those discussions we'll be having today. Then number 2 is we want to ensure that the data sets that are used for this innovation reflects Nigeria. Nigeria has a lot of nuances. We have a lot of, cultural nuances that impact how we talk, how we behave, how we take our healthcare system. And so we want to ensure that whatever innovation, whatever research people will be building, be collaborating on, reflects the nuance that Nigerian stands for. And third, we also like to emphasize real problem with practical scalable tools. An example of that is a lot of people argue that we don't have infrastructure, there's an infrastructural gap, but how can we build AI tools that can scale even with minimal infrastructure? You talk about USSD, SMS tool. Can I reach a doctor just using a text SMS? Things like that is what we are, looking at in ensuring that AI-enabled healthcare is scalable in Nigeria, even with the low infrastructural gap. And then lastly is to invest in people. For us to build a thriving ecosystem in Nigeria, there must be an investment in people. It is now and always. People needs to be helped. People needs to be mentored, which is one of the things the Diaspora Connect is doing to ensure that we have able hands that is able to support AI innovations both now and always. I know a lot of people, there's the syndrome called the jackpot syndrome. Yes, even when people leave the country, we still have people that are in the country that are able to support AI-enabled healthcare, and that is why we are much focused on investing in people. So I'm going to take a pause here and yes, I'm going to take a pause here and just to allow the conversation to continue. So if you want to learn more about the Nigeria AI Collective, we have a website. So my colleagues will drop that on the call so that you can check out some of our other innovation beyond the health sector and some of the other things that we are doing. Thank you so much, TJ. So I think I'll hand over at this point. Thank you very much.
Okay, thank you, Sean. Thank you, Sean. I know that on the agenda, the next thing we are to have is some expose into the Nigeria AI Collective, and seeing that Dr. Adekombi is not around. So do you want to also take us through that, or have you done that already?
Yes, so for that, we're supposed to highlight the 5 focus pillars for the AI Collective, which is what I shared before I narrowed down to the, health, yes, the
Okay,
health focus.
Yes, that's awesome. Thank you very much, and it's interesting. So I'm looking at the what you call it now, at the message box. Can we please have the link? Okay, is it okay? This is it on the screen. Okay, so can we have it typed in the message box? Because people might not be able to, click on this. So let's also have it typed in the message box so people can copy and put in their web browsers. Thank you very much. All right, so up next, we have a quick pre-test quiz. A quick pre-test quiz. And I'm very interested to see, what the result is going to look like. And so we want everyone to partake. So if you are looking at your screen now, you will see the pre-test poll. So please attempt the questions, right? Attempt the questions. Don't worry, nobody's going to fail. So in case you have, examination phobia, you're not going to fail. This is just a pre-test poll. So please let us, we have a few minutes, just a short period of time. Let's quickly respond to the questions. All right, thank you very much. I'm seeing the count of people as they're responding to it, and it's, continuously increasing. So thank you. Please attempt the poll. So we'll just take a pause for about 5 minutes while we allow you to take the pretest quiz. And after the pretest quiz, we'll have a presentation and dialogue, which is going to be very interesting. So I'll say, fasten your seatbelts, and let's expect to have an interesting conversation once we're done with the pretest quiz. If someone is saying, please reload the quiz. If you're having any challenge with the poll, please kindly just let us know. Put it in the message box so that if there's anything we can do to provide support, we can do that immediately. But I can see the poll on my screen, and I'd like to believe everyone else can see it on their screen too. All right, so far 60 people have attempted it. Please, let's, all right, 64, 65, 67, awesome, 69, 70, great. Oh, Solomon, is for people who erroneously hit submit without scrolling down, and maybe they answered only one question, is it possible for them to have the quiz come back up again? I doubt that is possible. Is it possible?
I'm not sure. Maybe the IT guys can help us with that.
Okay, I doubt if that's possible. So please, there are 7 questions if you're just attempting, so that you don't hit end poll or submit. after answering the first question. All right, we have 90 attempts so far. All right, we have a few more minutes, so if we can just quickly round this up and move on to the next item on the agenda. All right, so we're at 4 minutes 45 seconds. So I see that we have over 100 people making attempt, and I'm just going to give us 2 more minutes. Oh, I mean 1 minute and a few seconds. So once I say pens up, we'll just stop, and then the poll will end. So once I say, well, I mean, we're not using pens, but maybe digital pens to symbolize what we're using to click. But once I say pens up, and then the poll will end so that we can move on to the next item on the agenda. So we have 30 more seconds. In 30 seconds, the poll will end. One 24 people have attempted it. That's awesome. So we'll see the poll result at the end of. Oh yeah, apologies for those who are having issues with the poll. We apologize. Apologies. All right, in a few seconds, the poll. Okay, I think the poll has come to an end. Awesome. Okay, so so let me just put it out. Sean, do you want us to share the result of the poll immediately, or should we do it after the conversation?
I'll share.
What did you say, Solomon?
We're not
No, we're not sharing the results for now.
Okay, great. All right, so thank you very much, everyone, for participating in the poll. That was quite interesting. Yeah. All right, so we're moving to the next item on the agenda, which is an expert presentation and dialogue. So there's going to be a presentation, and after the presentation, there's going to be a dialogue session. And the topic or the subject of conversation is health and AI, successes, gaps, human resource for AI in health, and future directions in AI for health. I'll take that again. So we're discussing health and AI, successes, gaps, human resources or human resource for AI in health, and future directions in AI for health. And to engage in the presentation and the dialogue, we have two experts, two speakers. The first person is none other than the Senior Technical Advisor, Digital Health, the Federal Ministry of Health and Social Welfare, in person of Dr. Leke Ojewale. And to engage in the dialogue also is the Deputy Director, Global Health Informatics, eHealth Africa, Mr. Abdul Hamid Yahaya. So I'd like to cede the floor to them and welcome both of them, Dr. Leke Ojewale and Mr. Abdul Hamid Yahaya. The floor is yours, sir.
All right. So I do not know how this is gonna work, but Doc, shall I go ahead or?
Yeah, please, Dr. Leke, nice to have you. Please go ahead. You can proceed whichever way is most convenient for you.
All right.
Thank you.
Sounds good. Let me just make sure that I have. Okay, beautiful. Can you guys hear me? Can someone just confirm that I'm audible?
Yes, you're very audible.
All right. So let's go through the normal greeting to you, Doctor, the multi-ministerial delegates that are present here today, distinguished colleagues, partners, innovators, members of the amazing Nigeria AI Collective. A very good afternoon to you all. Apparently, it's a virtual call, so I imagine some folks would be probably morning, wherever you are, or maybe even evening. So perhaps I should say good day to everyone. Let me begin by sort of thanking the Federal Ministry of Communications, Innovation and Digital Economy. I thought I saw Dr. Bumi Ajayi on the agenda. I remember connecting with him in DC. I think he leads AI for Minister Boston. So let me just begin by thanking the Ministry of Communications, Innovation and Digital Economy, as well as the conveners of these amazing event today, HemDoc and eHealth Africa, for sort of organizing this timely but yet super important conversation. And as a matter of fact, I'm truly honored to join this timely conversation, even though not the most convenient time. I have to travel for some family engagements. But I think it's very timely to have this conversation as we sort of reflect on how AI, artificial intelligence, can help reshape the way healthcare is delivered in Nigeria, healthcare access, and sort of equity across Nigeria. So as someone that I've sort of spent the last decade or two of his life navigating the intersection between healthcare, public health and digital innovation and technology in Nigeria and globally, more specifically, I can confidently say without attempting to hurt anyone's feelings that AI is not just another technological opportunity here. It is, in fact, an imperative, if I may, like a strategic imperative. It's a must at this point. It is an enabler that when rightly applied, the highlight word now, zooming on rightly applied, it can sort of strengthen blood safety, predict maternal complications. It can help support chronic disease management like cancer and in fact unlock system-wide efficiency. But as we think of AI, the promise of AI, it sounds cool, the whole idea of ChatGPT and whatever other AI tools that we all use in our daily life now. The promise of AI sounds cool, like I said, but it must also be matched by the investment that goes into it. There's a lot of investment that goes into AI. Workforce readiness. So I mentioned investment, workforce readiness, the governance piece, and also lots of collaboration, especially if we want the solution at scale and if we want it to sort of fit the context of our own Nigeria, to fit the local context of Nigeria and serve the 200 and something million people of Nigeria. So very quickly, to set the stage, I think it's important to sort of look beyond Nigeria, to look beyond our borders and look at countries like Rwanda. Rwanda, through AI-enabled logistics and data systems, over 90% of health facilities are now digitized. They have digitized health records. AI-supported supply chain have sort of helped reduce waste and reduce essential medicine stock outs. In a place like India, you could argue that, well, Rwanda, the population of Rwanda, pretty low, right? In a place like India, AI is being used to detect high-risk pregnancy. Today, one of the main focus of the Minister of Health and the Ministry of Health in Nigeria is to see how we can very, very quickly crash maternal and child mortality. The numbers are staggering. The data is just it's pretty sad, you know. So AI in India is helped to detect, you know, high-risk pregnancy, to diagnose diseases like tuberculosis, you know, very particularly in rural settings. And in some, not all the states, but in some pilot states where AI is being deployed aggressively, they've seen some early um, 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 detection cases, or I should say, early case identification of over 40% of what it used to be. Another country in Estonia, you know, with more than 99% of health data digitized already, AI drives real-time analytics for everything from patient management to national outbreak forecasting, which of course is still a gap for us in Nigeria. Now, contrasting all this data, now I know Estonia is I'm sure folks in the audience are probably thinking, you know, Estonia is a very small country, but regardless, I feel like Nigeria can definitely do better. There's a lot of gap. There is a lot of room for us to sort of improve. Now, contrast the data of Rwanda, India, and Estonia that I just briefly mentioned. Contrast that with Nigeria. You know, fewer than 25% of our health facilities are digitized. You know, I said fewer than 25 because if I say fewer than 25, that means below 25%. The actual number I cannot tell you. The data is sad, you know, if I may. And most people that know me, they know I'm pretty blunt when I speak. So I apologize. I hope I'm not offending anyone today. But like they say, data don't lie. It's the folks that present the data that often do not speak the truth. But we have fewer than 25% of our health care facilities in Nigeria still yet to be digitized. Health information systems remain fragmented, if I may even say hyper fragmented. We collect less than 25% of the blood our population requires annually, you know, and so you see things like postpartum hemorrhage just killing, you know, women that definitely do not deserve to die, you know, just like that. You know, the numbers they're pretty sad. You know, in Nigeria, we need about over 2 million units of blood, about maybe 2.5 million units of blood. We only collect about 500,000 units of blood annually. So this is very sad. So, but despite this, I do not only just want to paint the problem. Despite these challenges, the opportunity before us is immense. Number one, we can easily learn from what the other countries have done, because whilst they seem ahead, they've also made certain mistakes, and we can learn from them. You know, like my friends know, you know, when I do not like to learn from my own mistakes. I do not, you know, in my personal life, I do not like to learn from my own experiences. I sort of like to learn from other people's mistakes and experience. And so like, I feel very strongly that despite these challenges, you know, there is immense opportunity, and AI can quickly or very quickly help us bridge the gap if we are, in fact, very deliberate. If we're collaborative, which I think we are already as a country, you know, if we're non-relenting and if we have the political will, and I think the political will, it cannot be better than now. If it's not now, it's not ever going to be done. So very quickly, I think I have a few more minutes left. Very quickly, in the next few minutes, I'll reflect on just four items. What are some of the early wins Nigeria has achieved using AI and digital tools in general? So some early wins. The second thing I'm going to quickly talk about is the gaps that continue to hold us back from scaling and from equity. Third would be the emerging concept of HR4 AIH, or the sort of talking about the human resource part for AI in health. I believe that was one of the questions. You know, at least I answered that question correctly. Tijesu, can you check if I answered that question correctly? I'm just kidding. So So the human resource for AI in health. And then lastly, I'll speak very briefly about the vision of how we can sort of help shape the next phase of AI-driven health transformation together as a country. So number one, despite our challenges, Nigeria is not starting from the scratch. If we all agree, we've done some work, some amazing work. You know, we've already begun to demonstrate the value of AI and digital health in real world scenarios. You know, an example is the open LMIS. You know, it's been deployed in some local government areas, and there we've seen logistics management improvement, you know, some predictive analysis, helping to sort of with vaccine storage and stocking and forecasting. These, of course, has led to fewer expiries, quicker distribution in case there is a need to, we move it to somewhere else, and then more efficient cold chain operations. Let me for those that do not know, you know, drugs do expire, vaccines do expire. And if, for example, a state in Nigeria or a local government in Nigeria have a donor, like, you know, ship them just paracetamol, all right? They just give them like a truckload of paracetamol that is going to expire in like 6 months, you know? And that population is only, even if all of them, if they're all sick, they're only able to take like half the truckload. What happens to the rest of the truckload of the paracetamol? So as simple as that is, it's a problem, unfortunately, but Open LMIS is helping with some of these logistics management issues and redistribution. Another one, thanks to I should give kudos to Gavi and Chai for these. I think they've been at the forefront of these. They've been very helpful. Similarly, platforms like LiveBank, I believe LiveBank is using AI-driven matching algorithms to sort of connect patients and blood donors and blood donor banks real time, helping to reduce sort of the turnaround during emergencies. You know, in an emergency situation, if you need blood and blood is not there, it's not quite a good thing. It's very, very bad prognosis for the patient. So in maternal and newborn health, we've seen AI-enabled tools being piloted to sort of predict complications, to also track very high-risk pregnancies, and to guide community health workers. Amazing, very hardworking group of community health workers through decision making, you know, as they work in those, you know, if I make crazy conditions, you know, yeah. So the second item, so I said I'll talk about 4 things. Again, the early wins of Nigeria. So those are some of our early wins. So I'll talk about the gap that continues to sort of hold us back. Talk about the concept of HR for AIH, and then I'll talk about the vision for the next phase. So now I've spoken about the early wins. So I'll quickly just talk about the gap right quick. So to be honest, the wins are sort of isolated. Like I think whilst I was talking about the win, I talked about the local government area, LMIS and things like that, you know, but these wins, they remain super isolated. And the promise of AI is still very much out of reach for most of our healthcare system. And the reason being, first, because of lack of data visibility at scale. You know, I mentioned earlier that health information remains super fragmented, hyper fragmented among, you know, across platforms, across states, across MDAs, across ministries, institutions, you know, and without the proper integration, AI cannot function effectively, you know. So that the lack of data visibility at scale is still, I mean, it's a reason why there is a gap. The second reason is the lack of national interoperability enforcement. You know, so AI solutions are still built in silos. You know, they're disconnected from the broader system. These are some of the gaps that the Nigeria Digital in Health initiative, which I sort of lead is sort of helping to bridge. Third, we face challenges with infrastructure reliability. Yes, Nigeria is trying, but there is still inconsistent connectivity in rural facilities, limited access to hardware, data storage. Without these things, AI is useless, if I may. And then finally, the governance framework, the AI governance framework, especially around the ethics, the bias, the patient consent, and data security. Now, put AI in anything, it's okay, but then when you're talking about patient data, you're talking about human life, you're talking about AI then making decisions, that would then determine whether the patient survives or the patient, does not survive. Then there has to be some governance framework that guide, the consent system, the ethics, and data security, especially we're talking PHI here, protected health information. So like I alluded to a moment ago, the NDHI, the Nigeria Digital Health Initiative, was established in March 2024 by the former Minister of State, now led by the Minister of State now, to address exactly some of the aforementioned challenges, and progress from data standards to the development of the Nigeria or national digital health architecture is sort of laying a foundation for inclusive and scalable AI adoption. So now the third item, so remember I said I'll talk about 4 items. The first is sort of the early wins, the second are the gaps which I just highlighted, and then the third is the emerging concept of human resource for AI in health. So let's be clear, technology alone doesn't transform anything. It doesn't transform the healthcare system. People do. I believe the lady that spoke earlier, amazing speech, by the way, spoke about the people. Technology alone is not going to change the way healthcare is practiced in Nigeria. It's not going to do anything as far as health outcomes or patient satisfaction is concerned. The people are going to, and to scale AI responsibly, we must invest in the concept of HR for AIH, the human resource for AI in health. And what does this investment, what does this mean? It just simply means that we must train our healthcare workers, not to become coders. I'm not asking for every healthcare worker, to go ahead and start coding with Python or whatever else, but to understand how AI can support their workflow, it can inform their clinical decisions, and also how AI can improve patient care, and before we even get to that, is then the whole digital literacy piece. Is even just knowing and teaching folks how to do basic things on the computer, how to turn on a computer, how to, so there is that gap, and I hope that, as part of our initiative as well, and not just us, I know that the Minister Bosso and his team are also working tirelessly, to bridge the gap as far as digital literacy is concerned. I know the Ministry of Education have some work in there as far as literacy is concerned as well. So this also means like building public sector capacity, and as well expanding, cross-sector expertise, by supporting fellowships, and career pathways that sort of bridge the gap between health and technology, in data science, bioinformatics, and health economics. Till now, I imagine how many schools of health informatics exist in Nigeria. When I was going to do my master's in health informatics, I looked at a few schools in Nigeria. I didn't see quite a lot of them. So I hope that, this is some of what we can do to sort of bridge that gap, and equally, important is then inclusivity in the development and deployment of AI tools, so we build solutions that reflect our populations and our present realities as a nation. Like I said earlier, NDHI, the Nigeria Digital in Health Initiative, is also working very tirelessly to align capacity building and efforts across the states. Just very recently, actually, we had each of the honorable commissioners of health, nominate based on certain terms of reference and qualifications, nominate a state digital in health focal persons, that are sort of going to help within their own state champion anything digital as far as health is concerned. So we're also developing a playbook, like kind of like a toolkit for each of the states as far as as far as digital health is concerned, as they attempt to adopt the Nigeria Digital in Health architecture that then brings, everyone together for seamless health information exchange and interoperability. So the number 4th item, but before I get to that, I've spoken about 3 things, right? I said, I spoke about the early wins as far as Nigeria is concerned. We did not start from the scratch. I talked about the gaps. I talked about the imagined concept of the human resource for AI in health. And then now I'm just going to talk about the 4th item, which is, of course, not the least. So a vision for the next phase. So then then this leads me to asking the question that where do we go from here? All right, what do we do? What's next? We need to move from proof of concept. Nigeria likes a lot of proof of concept. A friend of mine still called me today asking me that, Leke, when are we going to do a proof of concept? It's a different, I was talking about something entirely different, but then it's all about proof of concept. When are we going to move from the proof of concept, honestly, to proof of impact? When are we going to start showcasing that, we're actually making impact? That require a shift, in how we design, how we fund, and how we govern digital health interventions. So for me, I think personally, I'll just highlight very quickly, 3 or 4 things of what I think, the future looks like. I see a future where AI is embedded, within, the system we're working on, the National Digital Health Architecture, is embedded, highlighting the word embedded now, not built around it. Not us building and then thinking about AI, artificial intelligence at the end of it, and then seeing how we can work things in. So we want to see, how AI can in fact be embedded within the Nigeria or the National Digital Health Architecture. I see a world where data can flow securely and responsibly across platforms, bearing security in mind, understanding that PHI is very, very sensitive data, from EMR to the client registry, to the facility registry, to the healthcare workforce registry, to disease surveillance tools, enabling real-time insights and informed policy and decision making. I see a world also, I see Nigeria, where states become more digitally empowered, with clear implementation plans of how they're going to move from 0 to 100. Not going to happen in a day, may not even happen in a decade, but can we start seeing, some movement, starting now? Can we have a plan, that can stand the test of time, that is very inclusive, and beneficial to the people, to the specific needs of the people of that state? I also see a future where, in each state in Nigeria, there's a budget line item for AI-based health innovation. There's a budget line item. It's not just private sector that is trying to force themselves into government, but government is intentionally, trying to pull in private sector and these amazing innovators that have the solution to our needs. I also see a world where, in Nigeria, where partnerships are grounded in national priorities, where there's a constant alignment between donors, innovators, and private sector players, aligned together to with the Nigeria's roadmap. Not even just aligning with the roadmap, even the aforementioned. Well, I'll mention again: partners, donors, innovators, private sector actually coming together to help even shape this roadmap, to be a part, as we design, as we write the roadmap, for them to be a part of it. That was what we did as far as the digital health initiative is concerned. We had private sector. We invited them in. We still had a stakeholder check-in. I believe it was the beginning of June 2nd to June 4th, if my memory serves me correct. Then in Abuja, where we had the honorable commissioners, I believe we had like 20 something of them. We had the minister. We had a robust representation of the private sector and innovators coming, as we, like design together, as we move forward together, certain decisions are not just going to be made by folks in government. I cannot do everything. Government cannot do everything, right? Like, so
permit me to interject, Dr. Leke.
Please.
Wanted to nudge you around the time, and
okay.
Yes, thank you, sir. Thank you, sir.
Okay, how many more minutes do I have? I'll probably just wrap up now.
Yes, thank you. Now we can go into the question and answer.
Okay, thank you very much, sir.
Thank you.
So I see in Nigeria where, we're very much intentional about, bringing in the donors and private sector. Yes, not allowing the donors to tell us, this is the way to go, but, selling our idea to them. So from ground up, they understand that this is what we're trying to do from the beginning. Most importantly, we must ensure that equity is not an afterthought, but part of our design principle from the get-go. AI should not widen health gaps. If anything, it should try to help us close the gap, to close the divide. Through the Nigeria Digital Health Initiative, the Federal Ministry of Health is committed to this vision of AI. We cannot do it alone. I think I said that earlier. We need everyone, from developers to private sector to policymakers, to help us sort of co-create a health system where AI is in fact useful, or I should say AI in fact works for everyone. So I think I'll go ahead and pause right there, because I also have a hard stop in the next 6 to 7 minutes. All right, thank you very much. That's all I have.
Because you have a hard stop, I'll say let Mr. Abdulhamid quickly engage with you in the dialogue.
Thank you very much, Dr. Leke. We're quite honored to have you on this webinar, and as usual, you've done justice to the great justice to this topic of our discussion. We had no doubt, so you just confirmed that. Because of lack of time, we're going to have questions, but I still want to use the platform to say how grateful we are, especially for interrupting or disrupting part of your vacation. You were on travels, and yet because of your passion for this type of activities, for health in general, you still decided to make time for us to for this webinar. So I really appreciate that, and I hope that you won't be interrupted again for the rest of your vacation, hopefully. Thank you very much. So we'll take just 3 questions. I apologize because of the time, and I think I will just go with first in, first out. I think we have 3 questions that I see on the chat. I apologize for the other questions, but we are going to follow up and respond to all of the other questions and send them to you. So I see someone asking the question of how do we integrate AI in low and middle income countries, of which Nigeria is part of it. And I want to beg, please, maybe 1 minute, 1.5 minutes for each question, so that we can do justice to the 3 questions that we have. Thank you.
All right. I think the question says, how do we incorporate AI into healthcare, right?
Low and income countries. Yeah. So we can restrict the boundaries, put the boundary there to be healthcare. Yeah.
Okay. Yeah. It's been done in places before. In India, like I mentioned, in Estonia, we've seen AI. I think one very specific example that came to mind that I think is super applicable to the context of Nigeria is the whole idea of the AI guided ultrasound, right? So for those that do not know, right? So ultrasound is, well, let's talk ultrasound in pregnancy now, right? When a lady is pregnant, and you in order for you to see the image or to see the anatomy of the child, you need to do an ultrasound, right? So it's possible to actually infuse AI into this ultrasound. It's called the AI guided ultrasound. So amazing community healthcare workers, all right, all they just need to do is just place a little tool, all right, on the tummy of the patient, all right, and then someone else elsewhere is going to read. Of course, AI is going to help, all right, with the imaging, and then someone else, a qualified healthcare professional, is then going to read the result of the image. All right, and this can be done in mass, right? So it would only take like few minutes for each of these ultrasound. So you can have like patients line up like 200, 100 of them per day. So you can scale it, right? So AI is very, very useful as far as ultrasound or ultrasonography, which is useful for early detection in pregnancy, and to also manage complicated or potentially complicated pregnancy. I hope that helps. Over.
Yeah, absolutely. Yeah, thank you very much for that. We go to the next question. This first question, I think I didn't do justice, but I didn't say who was asking the question. Emmanuel Obokirisi from Instrat Global Health. We thank you very much for that question. So the second one is about health information remaining fragmented across different places, and without proper integration, AI cannot perform as it should in Nigeria. This one is from Precious Ibe, Data Science of Nigeria, DSN. Over to you, Dr. Leke.
Please read that question again. I got a bit distracted.
Health information remains fragmented across different places, and without proper integration, AI cannot perform as it should be in Nigeria.
Okay, so what's the question? Because that's a fact that was just stated.
Yeah, I guess this person is talking about the challenge.
Comment.
That's the challenge, right?
Okay, yeah. So yes, I think I spoke about these when I spoke earlier as well, that, without the proper integration, it's not fragmented as far as I'm concerned. Health systems in Nigeria is hyper fragmented. I think we can speak freely. We're all youths here, so we're all Gen Zs. I'm just kidding. Yeah. So I think we can speak freely, right? So health systems in Nigeria, as far as I'm concerned, is not fragmented, it's hyper fragmented. You have all the systems. Even, I shouldn't get into specifics of things, but yes, I totally agree with you that without the proper integration, all right, AI, is not deployable. It's not going to be super useful, or at least we're not going to be able to take much advantage and use it to the optimal that we can leverage it upon. Now, AI depends very much on the data collected, at least in the context of Nigeria, right? And so if you have this system that is storing this data this different way, and you're even asking them to integrate with you, and it's a problem, all right? And these other systems doing their own thing, and then that other system is doing their own thing, it's a problem, right? It's not gonna work. Now, what are we doing? The Nigeria Digital Health Initiative, what we're doing is, so we've built a set of standards that we hope that everyone, as far as digital health is concerned, will follow. So that way, like, we can in fact start integrating. We've written a draft document. I do not know how many of you guys were at the Nigeria, the national stakeholder event that I had in June, I think June 2nd to June 4th in Abuja. So we're launching a document, it's Nigeria Digital Health Architecture document, that talks about interoperability, HIE, and how we sort of plan to go to harmonize all this data, to bring them together, and for patients to in fact start taking ownership of their own data as they move across the continuum of care. Because it is the same patient that moves from the community level to primary to secondary to tertiary, right? So why do
Is it from my side? Did we lose Dr. Leke?
Yes,
I think we lost him.
Thank you.
Oh, okay. So I see 5 minutes over time. Not sure what we want to do. The third question anyway? Dr. Leke isn't even around for the next question. So I just want to implore that what Dr. Leke talked about, the DHIN have been doing a wonderful job. It's good to follow them, track them, because the stakeholder sessions, I have joined all of them. They are the best opportunity for you to share your feedback, especially regarding this question that was asked about fragmentation. There is an ongoing effort to connect all of our health information management system so that that fragmentation issue is sorted. You will have an end-to-end interoperability across all of the health information platforms that we have in the country. So follow that. DHIN, follow that, and then I'm sure you'll be able to get an opportunity to voice out what you need to say on the stakeholder sessions. Over.
All right. Thank you very much, Mr. Abdul Hamid, and thanks again to Dr. Leke for providing us with insight. I see a lot of people sharing deep appreciation for the things he has shared so far. So please, we're copying out the questions, and hopefully we're able to provide answers post this webinar. So please, if you still have questions, please, you can put them in the message box. Before we go ahead to the next agenda, we would like to recognize the presence of someone very, very important in the scheme of things. We would like to recognize the presence of the President of the Healthcare Federation of Nigeria, in person of Dr. Njide Ndili. We recognize you, man. We acknowledge your presence, and we're excited to see you on this call. Thank you very much. Yes, you can applaud her. Thank you very much. Thank you very much.
Okay. Thank you, everyone. It's been a wonderful conversation so far. For this session, what we'll be doing would be, given that we have very wonderful, credible stakeholders in the room, it's more like a discussion. So on the next slide, we will just showcase the 4-point agenda, key focus of the Federal Ministry of Health agenda on, from the Ministry of Health rather. And so we can then have conversations from the room, discussions, comments, to say, how do we ensure that whatever AI tools that we are deploying, whatever AI tools, whichever way we're going about integrating AI into the delivery of better care for Nigerians and Africans at large, how do we ensure that these tools help or are integrated towards helping the ministry achieve this 4-point agenda? So it's good we can start having, you can put the comments and let us know what you think in the comment session. Let us get your feedback, your comments. How do you think we can build AI tools that are resilient enough to help us achieve the 4-point agenda? The first is on improving governance, enhancing leadership, transparency, coordination, and accountability across all levels of the health system. So how do we think we can equitably and efficiently deploy AI tools that can help within the Nigerian health sector, help us improve governance across all pillars of health delivery? And then the second is on population health outcomes, essentially delivering better health results for Nigerians by strengthening primary health care, reducing disease burden, and increasing access to essential services. And then the third is on unlocking the value chain, promoting local production of medicines, medical supplies, and equipment to reduce dependency on imports and boost the health sector. And the fourth is on health security, building capacity for epidemic preparedness, response, and resilience against public health emergencies. On this last, but just ensuring that we are not reactive, but rather proactive in terms of detection of epidemics. The system is, of course, taking a cue from 2020 COVID. So if there is a recurrence, hopefully there's not, but whichever, the system is very well prepared to counter the negative effects. So we would love to get your comments, your opinions in the comment section, contributing to how do we think we can design AI tools, we can deploy AI tools that can help us to achieve all of this. Thank you, Dr. Njide Ndili, for joining us, for joining the conversation. Thank you. So glad that you could make it. We would be also honored and very excited if you can also share your perspective on this. If you can, you could just let us know, and then we can, I think one of the hosts can unmute, then give you the room if it's possible. Sorry for putting you on the spot. So we excited. So can we, this is supposed to be conversational. So how do we think we can deploy applicable AI tools? From the demo sessions, hopefully we're able to get that correctly. Some of the demos would have shown how organizations like MDOC, like eHealth Africa and Instrad Health have already designed AI tools that are already helping address 1, 2, 3 issues regards to population health outcomes. For MDOC, we developed CHEM. CHEM is a virtual health coach that is deployed for chronic disease self-management as well as other health conditions, and is deployed within MDOC's Complete Health app. It currently supports text and voice interaction in both English and Nigerian pidgin, promoting inclusivity, enabling individuals with lower literacy or digital skills to access tailored health guidance. So more like the virtual health coach chatbot, it can provide answers on large expanse of questions. From eHealth Africa, they've also developed Biscuit, essentially called Blood Information System Kit, which is an AI-enhanced digital solutions to optimize blood supply ecosystem across Africa. By leveraging real-time data and intelligent forecasting, Biscuit improves blood inventory visibility, predicts shortages, and streamlines donor to patient workflows. Let's go, please. Yes, I don't know. I can't see. Can we, if there are comments, so that I can take them in the comments? And then for Instrad Health, ComTB, which is a mobile screening and surveillance application developed by Instrad Global Health Solutions. And it has been deployed nationwide as part of a broader effort to modernize TB surveillance. Integrated with Nigeria's early warning outbreak recognition system, EWAS, the app uses AI-powered alerts to flag TB to act quickly and precisely. Let me also add that what this means is, if you are an innovator in the room who is really passionate about improving health outcomes, help building efficient digital tools that can help us advance health outcomes, population outcomes in the country. You have a Federal Ministry of Health that is very excited for this partnership, and there are clear areas that we can, so whether it's around improving governance, whether it's around population outcomes, unlocking the value chain, and then improving health. If I can take, okay, it would really be great to get some feedback. But for me to round off this in the interest of time, so we are essentially calling on innovators, think outside the box. If you're looking for an opportunity, oftentimes it is said that in Nigeria, there are no opportunities for digital health platforms, digital health innovators to grow. But if you are thinking of areas where you can deploy these tools, then think about tools that can help improve governance within the health system, improve population health outcomes, unlock the value chain with regards to promoting local production of medicines, local supplies and equipment, and also improving health security. Thank you so much. If we can unmute the mic, it would really, really be great. And so we can take feedback from one or two people. Over to you, TJ.
All right. Thank you very much, Mr. Solomon. Thank you very much. All right. So I'm hoping that we'll be able to take the demo. But just before we attempt it again, can I please invite Sean to talk to us about the hackathon and also the result of the poll we had earlier, just before we had the expert presentation and dialogue session. So, Sean, over to you.
All right, thank you so much, TJ. So we are going to be having a post poll. So there was a pre-poll. So if you're just joining, we had a poll initially. And so we're going to be running a post poll. And the idea is to, understand if what has been discussed, the conversations has really, changed. What were the things that you had considered initially? And now after the session, what are the things you're beginning to learn? And then we're also going to have like an hack poll. So the phase 2 of this conversation is to develop. Now we've talked about it. Can we start developing AI-enabled solution for healthcare? So we're going to be putting up some topics and we'd like you to vote. What are those areas you feel is the most important that we need to innovate on? So that will be like the topics you'll be seeing on the poll, and that's what we really want to drive. We are going to be having an hack, and for those that are yet to join our WhatsApp community, please join, because we are going to be announcing it in that community first so that people can begin to come together. So in the community, you have health experts, you have AI developers, and so we want to see how to start infusing the collaboration that we had initiated already to start this conversation. How can that drive the innovation that we want?
Yes.
Okay,
Good.
thank you so much for putting me on the spot. I didn't want to speak because he was speaking. Of course, very interesting pillars, but I just wanted to make a couple of observations because I think that in Nigeria, we're not lacking fantastic innovations, but the problem we often tend to have is that they are deployed in silos. So if it's the Federal Ministry of Health that is seeking, collaboration or integration, I think the first thing is, I was also listening to Leke, I don't know if he's still on, is what is the infrastructure upon which the data is collected, the AI tools are deployed, and so on and so forth. Because if you think about, for example, an Apple iOS platform, once that platform was developed, then you saw a lot of applications being layered on top of that platform. So I think this is one of the points that was raised by the Lancet Commission and the DTH Lab, which is that the enablers of digital transformation and AI must be put in place. And there are 4 things. The first is, is it power, is it data, is it literacy, and how do we ensure that those are put in place? And the people who are generating the data and those collecting the data, do they see the bigger picture? Because only when you see the bigger picture of what that data will ultimately produce, then you pay attention to the accuracy of the data that you're collecting. And this essentially maybe the health workers or the community health extension workers in rural areas and so on and so forth. That's the first thing. Second thing is the governance around that data. I think we're at the stage now where these solutions are being developed, but nobody's thinking about the governance. And, who owns the data? What is it being used for? Is it the government to provide the governance structure? Do they have the technical capacity to develop the governance structure around how AI can be used ethically? Because we're in a position where it can be used unethically. So this also has to be thought about. And finally, just to wrap up, is the interoperability of data. Currently, data is with the providers, right? But I think it's also time to flip it around where the data is with the patient or the person generating whose data is being used, and how that data can be used with their consent. In other words, data with the owner, but used for public good, anonymized, and so on and so forth. So some of these thoughts, I don't know whether they've been discussed or whether they've been discussed, but it needs to be really integrated into some of the solutions that are being produced now. But having said that, I think we're on track in terms of thinking out loud, especially with the young generation that we have now, who should be at the table developing or being at the forefront of developing these tools. So I'll stop there for now, and I'll just look out for the demo. Over.
Thank you so much, Njide. the president of the Healthcare Federation of Nigeria. Thanks for that wonderful perspective. I see comments already. Kelechi Obi saying, in as much as we have different innovative apps and AI initiatives to improve health outcomes, I believe as a country, we should be talking about having a national digital health architecture, enterprise architecture for digital health, which will have the standards for any digital health innovators that will help for ease, integration, and interoperability. Thank you so much, Dr. Kunle Kakamfo from the Africa Hub for Innovation. We need some more framing of the ecosystem, governance, ethics, standards, a more open conversation and roundtable would be useful. Thank you so much. Oyintofe said, at AI for SID, we've done a social listening analysis on the use of AI for social good in HIV, hepatitis, tuberculosis, malaria, and mental health in Nigeria, and then having also shared the link to access the report. Ebuka Philip from DSN mentioned establishing more government-owned and private data centers within the country will significantly accelerate our national digital transformation agenda. He mentioned MTN's current initiatives in this space serve as a great example of the private sector's crucial role in building digital infrastructure. Thank you so much, Ndili. Thank you so much, Dr. Kakamfo. Also, Kelechi Obi, thanks to everyone for adding to this conversation. I think these are key points that would also go out as some of the key highlights and directions from this webinar. And in the interest of time, I'll just yield the mic. Please feel free to also contribute to the conversation using the chat. Over to you, Jason.
All right, thank you very much, Solomon, and thank you so much, Dr. Njide, even though we put you on the spot, but thank you for sharing your thoughts with us. All right, so just before Dr. Njide came up, we were about to take the poll. So we'll take the poll and then we'll show the demo videos. So over to you, Shell.
All right, thank you so much. So I'll be launching the post poll now. So I need you to confirm that you can see the poll.
Yes, it is live. We can see.
Yes, okay. All right, so everyone, please, let's attempt the poll, and let's try to avoid what happened at the pre-test poll. So there are 7 questions here. So when you answer the first question, please don't hit submit. Instead, scroll through the poll so you can see the next question until you are able to complete all the questions. So while we're doing that, we'll prepare to queue in the demo. So Shion, how many minutes do we have for this?
So we'll take 2 to 3 minutes for the poll, 2 minutes for the app topics, and then we take the demo afterwards and have closing comments.
Okay. Okay. All right. So when the 3 minutes elapses, you can just end the poll and then walk us through the hackathon topics we're going to crowdsource. Thank you.
Okay, so in order to spark conversation, I'll be reading the topics. So question 1, what is artificial intelligence primarily used for in healthcare today? So you have 4 options, pick one. So question 2, which of the following best describes the current gap in AI implementation in low and middle income countries? I can see a lot of answers coming in already. Please, let's keep it coming. Question 3, what does HR for AIH likely stand for? I'm seeing a lot of answers. Please keep it coming. I can see 26, 28, 30 people now. We have 178 persons on this call. So please, let's keep engaging the poll. Question 4. Which of the following is a common ethical concern in using AI in health systems? So we have about 30 seconds left. Question 5. One of the key benefits of AI tool like Chem, Biscuit, or COMMTB is. Question 6. What role do frontline health workers play in the success of AI-powered health tools? This is quite critical. We have about 12 seconds. The last question, why is local context important when deploying AI in health? Okay, we have 69%. I'm about to close the poll. So in 5 seconds, I'll close the poll. 1, 2, 3, 4, 5. So I'll end the poll. Thank you so much for your responses. So I'll just quickly launch the hack poll. So this is just to give us an idea of what are those areas to focus on. I know we have a lot of health experts on the call, and we just want to ensure that we're in the right direction for the hack that we're about to, pull up this year as well, which is a follow-up of this event. So I'm launching that right away. So AI healthcare hack topics, what are those areas, which is the most critical area you feel that we need to ideate on, we need to innovate on? So the questions are, the areas are on your screen. So we have 2 minutes. I have 18 people already, 20, oh wow, it's going pretty fast. I can see almost 50 people. This is for the, yes, now we have 50. Please keep your comments coming, respond to the poll as well. So we have 71%, 72. What is? I know all the areas are quite important, but for this next phase, we can only focus on one area. And we just want to be sure that we are in the right direction. Okay, so we have about 40 seconds more to respond to the poll. I have 92 responses out of 173. About 25 seconds left. We have less than 10 seconds. I believe everyone can access the poll. Okay, so I'll be ending the poll right away. So thank you so much. Thank you everyone for responding to the poll. Over to you, Jason.
All right, thank you, Sheila, and thank you everyone for responding to the poll. All right, so we're pressed for time now, but we have, a very interesting part of this webinar, which is the demo, which I believe everyone wants to see. So over to you, Mr. Abdulhamid, to help us play the demo.
Taking control of your health should be effortless. For over 7 years, MDOC has been empowering women on their healthcare journey, co-designing digital solutions that put them at the center of their care and extending care beyond facilities into their homes and communities. With Complete Health, you gain round-the-clock access to an AI-powered virtual health companion along with a multidisciplinary team, including a mental health coach, nutritionist, and fitness coach, all seamlessly integrated into one platform, ensuring you get the support you need whenever you need it. Ms. Ugolaye, who is 25 weeks pregnant, uses Complete Health for virtual support. With Chem, MDOC's AI-powered health coach chatbot, she gets guidance and answers to her health concerns, anytime, anywhere. Designed for inclusivity and convenience, Chem also converses in Pidgin and features speech-to-text capabilities, ensuring a seamless and accessible experience for all users.
Hello, Chem. I be like say my face and my hand dey swell. I no understand.
I dey here to help you. Swelling for face and hand fit happen for different reasons. Like when body dey hold water, allergic reaction, or other health wahala. Since you be 27 years old woman, e good make we check if this swelling fit be because of belle. You get belle?
Miss Laddie stays on top of her health with the health diary, keeping all her latest health information in one place, readily available when needed. She also sets personal health goals for her weight and weight circumference, staying motivated and in control of her journey to better health.
Okay, thank you. I will go hospital.
If you get any other thing where you want discuss or any other way I fit help you, abeg make you let me know.
Our vision is for Kem to be a health companion for millions of women and men across their life course. So take charge of your health today with Complete Health, your AI-powered partner for a healthier, happier you. Download the Complete Health app on Google Play Store.
Introducing Biscuit. In this video, we will discuss the challenges in the blood transfusion chain and the solutions Biscuit provides within the blood transfusion service in South Africa. The system we encountered on the ground could retrieve stock level and incoming donation information in real time. However, it couldn't process data relating to a crisis. Biscuit helps the system switch to an emergency mode for faster action and alternative release method of blood reserves. It provides and obtains data from multiple sources, making it an integrated system. Biscuit is a smart system that can integrate with an existing system, all other diverse systems across a chain. It can be adapted for use with mobile application and smartphones, and it integrates a geographical information system for optimizing logistics processes and moving blood products from one point to another in real time. The individuals responsible for the movement of donations and products are visible at any point in time. Biscuit helps to develop relevant data for crisis planning and management, enabling easy manipulation between locations and knowing who is close to what for activation of crisis mode. We have also modeled it based on the spread of facilities such as blood donation centers, blood banks, clinics, and hospitals. Biscuit can provide a quick overview and deeper analysis of an adverse event, enabling stakeholders to manage expectations. The mobile interface allows healthcare workers to capture donors in real time, pipeline donation plans, and create appointments. The lifestyle questionnaire asked about HIV status, tattoos, piercing, and previous blood transfusions, and sexual behavior. Biscuit also provides a quick overview and deeper analysis of adverse events, enabling stakeholders to manage expectations. The system captures all information, equipment, and consumables used in the process to provide insight into the stock level of blood products and other equipment and consumables. The geolocation capability tracks the driver's movement, and the system records information about the temperature during the transfer from one point to another for necessary action. An end-to-end solution.
Superior tuberculosis, leprosy, and Barilli ulcer control program uses CalmTB, a purpose-built mobile, offline-capable Android application to capture live screening data. This application is now in use in all states in Nigeria. CalmTB sends bi-weekly alerts to state TB managers identifying locations of possible TB hotspots by local government area and administrative ward. Upon receiving the CalmTB alerts, the state TB teams and community TB workers mobilize to screen patients in the locations identified by the alerts. CalmTB screening parameters analysis allows it to generate a pop-up notification on the devices if a case is presumptive. After lab results are collected, they are entered into the case profile on the ComTB app or on the portal, closing the data capture loop. The ComTB portal heat map shows TB hotspots, areas that exhibit high positivity rates. And this data ultimately informs the next cycle of alerts and activities. ComTB uses AI to empower TB workers' intelligence and smart actions that will enable them to combat TB more efficiently, towards the goal of eradicating TB before 2030 by NTB LCP Nigeria.
All right, thank you very much. So I'm glad we were able to take the 3 demo videos. And also a big thank you to everyone who has stayed with us from the beginning of the webinar to this point in time. You are the real MVPs. Okay, so to give us closing comments, I will just yield the floor to Abdul Hamid. In a few minutes, just give us a closing comments before we close out today's conversation.
Yeah, thank you very much. Just to confirm today, so can you hear me?
Yes, I can hear you clearly.
Okay, great. Yeah, thank you. It's not a physical in-person event, so I couldn't get everyone to give a round of applause, but I feel wherever you are, whether you want to do that electronically through the emojis, please do so. If you can clap. I think it's been a very wonderful session that we have. So I want to extend our heartfelt gratitude to all of the participants, the speakers, the AI innovators, the partners who have made this inaugural webinar focused on uniting AI and human capital for scalable community health impact, a resounding success. Kudos to all of us. Within the ambience or boundaries of the theme, from high-powered keynote speech by Dr. Olubayo Adekambi, who was ably represented by Oluwaseun Nifemi, to the deeply insightful expert session that was led by Dr. Leke Ojewale, and then the hands-on demos of AI-powered solutions like Biscuit, Chem, and ComTB, and the on-spot comments from Njide Ndili on siloed implementations and national platforms for AI like the iOS platform. I think all of these have contributed to make the webinar a resounding success. I'd like to thank all of them, especially our special guest of honor, Dr. Leke Ojewale. And then Njide Ndili, I was going to put you in the spot anyway, but I like the fact that you already raised, you volunteered even before I put you on the spot. I appreciate most of these conversations we've had on different forums. So I appreciate you joining also here and providing those valuable insights as usual. So this webinar has showcased the transformative potential of AI in reshaping the community health in Nigeria. We discussed artificial intelligence and health outcomes, workforce readiness, responsible AI, governance, scalable innovations, and so on. So I don't need to repeat, but what I feel is key is call to actions. We need to make sure all of these, each and every of the stakeholders, developers, let's join our AI for Health hackathon. For the health professionals, we need to make sure we pilot AI tools in our communities, right down to the funders. Let's invest in scalable, ethical, and locally built solutions, be it PPIs, venture capitalists, whatever it may be. So together, let's come together and build smarter, better, and stronger health systems. And as always, I want to say we should make sure we are building sustainably for the environment itself. One health, planet, the planet itself, animals, and then the human. If you build well and you destroy the environment, you won't have a place to host the solution like we normally say. So on behalf of the Nigerian AI Collective, I want to reiterate that it remains committed to empowering innovations that improve lives. The future of health in Africa is digital, and all of us, each and every one of us here, is a vital part of making that future real. Thank you very much.
All right. Thank you so much, Mr. Abdulhamid, for that closing remark. And thank you, everyone, for being a part of this. I would say if there are, and I'm sure that there are parts of this webinar, part of the conversation that really resounds, with you, resonates with you. I mean, you can go on social media and share your thoughts, tag MDoc, tag, Health Africa, and yes, we'll kind of continue the conversation with you. So let's remember, AI is only as good as the data we feed it, the people who build and apply it. And we've seen today what happens when innovation meets purpose. So let's take this conversation beyond this Zoom room and into real world solutions. The future is collective, and it begins with collaborations like this. Thank you for being a part of this first step. Have a great day from wherever you're joining us. Thank you.
Thank you, everyone. Bye-bye.